So this Ebola, it started in long time. There was already Ebola, then it's emerging. It came back, so it's called Ebola hemorrhagic fever. And you can the first animals who got positive with Ebola was the monkeys. The family of the monkeys, gorillas, and chimpanzees. So people who was having contact with these animals, it's from the body fluid of the animals, from the blood, from the feces, from the urine. The virus stayed there, and what that was transmitted to the person who is, having contact with these mammals, with these animals. So there was an outbreak in West Africa, and until now, it's an outbreak. So if you can see, we have, I think now, as of now, it's more than 9,000 deaths. So it's spread. It cannot be spread. Please quiet. It cannot be spread because some may be thinking that just casual contact, just sitting beside a person you can get the virus. No, it's not. You cannot get the virus with just a casual contact. You cannot get the virus from the air. You cannot get the virus from the water. Okay? You can get the virus from the body fluid of the person who is positive for Ebola. Okay? But this person, example, a person is detected to be positive with Ebola, they will be isolated. They will be placed in a isolation. They should be isolated. Okay? So it's the body fluid of the person who has Ebola. So from the vomits, from the blood, from the urine, from the feces, from the sweat, semen, spit, other fluids. So any body fluids that will come to the patient who is positive for Ebola is contagious. He can transmit the virus to the other person who is nearby him. Objects contaminated with the virus. For example, the nurse is injecting some medication to the patient positive for Ebola, and the other person was pricked of this needle so that patient can be infected, the person can be infected with Ebola. So it's from the needles also. Anything that comes in contact with the patient, medical equipment that comes in contact with the patient, because maybe some body fluids, splashes may happen, and some will be scattered inside the patient's room. So the virus stays there. So anybody can touch this one, and the person is touching the surfaces that's not being cleaned and being touched by the patient. Example, my hands already contaminated, I will touch my eyes and my mouth and my nose, so that virus can enter there. Okay? The virus, so same, but animals infected by the fluid. The virus can enter into what we call as mucous membranes. That's why if you can see those people in Africa, what are they wearing? They're fully covered, no skin exposure. The head, the mouth, the eyes, there's a shield, there's an N95 mask. Because the virus, if it will be with the body fluid, it will come into the eyes of the person, it will come to the nose, or to the mouth, then the virus can live there because there's some body fluids in there. And breaks in the skin, for example, you know that you have cuts, you have some bruises, the virus, and there's some body fluid of the patient that can be transmitted, the virus can be transmitted from those. So the virus is, as I mentioned in the previous slide, it cannot be from the casual contact, it cannot be in the air, it cannot be in the water. So it's from the body fluid that the patient is having, the patient who is positive for Ebola. Okay? So it's airborne. If you can see some patients who have airborne isolation, the negative pressure rooms, right? This negative pressure room will only be used for patients with Ebola if there are some procedures that's they consider as aerosolation or in bronchoscopy or intubation or nebulization. So we need the negative pressure for the patient. Okay? But if it's not, some patients might just have some fever, diarrhea, so they don't need a negative pressure room. Just a normal room, single room with a toilet. So who is at risk for this Ebola? Anybody's working in the healthcare environment, anybody's working in a hospital is at risk for getting Ebola. We don't know if the person beside us. We don't know if this person came from Africa, came from areas wherein the outbreak is identified. So we don't know. This person might have no fever, But later on, how many days after when it's staying with you or in any place, he might have developed some fever. So the person who came from that place, he is contagious. I mean contagious, that means can transmit the disease if he starts having fever, having symptoms, having diarrhea, having loose motion, having fever, or other symptoms. So if there's no symptoms, no transmission of the disease that will happen. Any family members and friends who is coming in contact with the patient is also at risk. Some people are getting the infected because of the wildlife, the animals that they are taking care of. Incubation period. So the person who is having contact or history of travel from that area, they will be monitored for 21 days. Example, one patient identified as having Ebola. And the person who is taking care of this did not do the proper precautions because at first the patient has no fever, only some other symptoms. So there was no precautions done, no PPEs, nothing. So this person will be considered as contact. So he will be monitored. His temperature will be monitored for 21 days. So within 21 days, he will be isolated, he will not work, he will stay in one place, and all the vital signs will be checked. So if the patient is having fever, and so that's the time they will screen the patient, the staff. So but if it's not, no fever within 21 days, kalas, he's safe. These are the symptoms. Patient may have fever, patient may have headache, diarrhea, loose motion, vomiting, stomach pain, unexplained bleeding or bruising, and muscle pains. Okay? Not all, one person may not have all these kind of signs and symptoms, but 1, 2, 3 of this, they will do the screening for the patient. It may not all be there for one person, but some of those symptoms that will appear to that will be detected to the person or to the patient, they will do the screening now. So for that's the first time, the first previous slides that I'm showing, that's how it's being transmitted. For you guys to know that how to protect yourselves. Then now prevention. Prevention to prevent the spread of infection, prevention for you guys not to get the infection. So just the hand hygiene and the proper use of your personal protective equipment. Okay? For such patient with Ebola, the person who will come inside, will only those person or those staff will do some management, some procedures. If it's not needed for you to go inside, you will not be allowed to go inside. If it's urgently that you have to fix something, you will go inside, but with supervision of the person who is assigned to watch over people who come inside and out. Visitors is limited with this kind of patients. We will not allow. If it's really needed because of some example kids that needs their mom, or old patient that needs their son or daughter, so may be face-to-face basis. But if, as much as possible, we will not allow visitors inside the patient's room. And for anybody who comes inside the patient room, they will be putting on all those personal protective equipment, and they will have to remove this carefully. The nurses of who's positive with Ebola in the United States, they were putting on all the PPEs, but the question is how come they were positive? Maybe because during the removal of the PPE, contamination happens. That's why later I showed you some slides how it's being removed. Personal protective, you're not using this, but there are times you're asked by the nurses to put on the mask or any personal protective equipment. So it's the gloves, your gowns, eye protection, and the face mask. And some may be considered as double gloving, depends on the procedure, but it's not maybe you will not encounter this one. Most probably it will be with the medical practitioners. Patient placements is a single patient room. This is the one that I mentioned. So if there's a patient with Ebola, we will limit the transfer of patients. If the patient is staying in this room, he will stay in that room. He will be negative. But if some procedures that cannot be done inside the patient room, there's no machine, there's no gadget to be used to this patient can go to other areas, but there should be proper communication. Okay? The patient should go there at the last procedure of the day, last people waiting in the department. So this is the gown. So make sure that all of your clothing is covered. So might as well we will recommend to put double gowning, because there are times your back is still exposed, so there should be one just to overlap. Then this is the mask. You have to fix it first before you start doing everything. The goggles and the face shields. If you can see the face shield in dental, it's more safe. Because to protect your eyes, nose, and mouth, to have these splashes of body fluids. Then the last is the gloves. The gloves is the last one, but the first thing that you have to remove is the gloves. Consider that this is the most dirtiest personal protective equipment, because you'll be touching the patient or any part of the patient's room. And also, when you remove your gloves, there's a technique to it, not to touch your skin. Okay? So, if you're removing your personal protective equipment, you have to remove first your gloves. And then, your goggles and face shields. But make sure that you do the hand hygiene before you remove your gloves, your mask and your goggles and your face shield. But make sure that you have to touch on the side. Consider always that the front part of your mask, front part of your shield, eye shield, front part of your gown are the ones that are contaminated. Maybe some body fluids was splattered into your gown. So don't touch the front part, always the side or the back part. You can see here, the gown, what was inside was the one that's outside now. We call this as, we used to call this as inside out. Okay, so this is the thing that we wanted to emphasize to our nurses, our physicians. When they will remove their PPEs, make sure that there's no contamination. You will not touch the dirty part of your gown. Okay? You just fold it inside out.